Hi everyone, Blake here with a continuation video on the ethics section of your exam. Today we'll be zooming into one of the 5 fundamental principles of ethics, which is non-maleficence. Non-maleficence, simply put, just means to do no harm. Now, one way that non-maleficence can be practiced is through education. Keeping your knowledge and skills up to date through articles and continued education courses ensures that we provide the best care to patients and society. Furthermore, we should consult specialists and refer patients when necessary, especially if the procedure is out of your scope of work so we don't put our patients in harm. If the dental provider decides to consult a specialist, the specialist should return the patient after care unless the patient prefers otherwise. When completed with the treatment, specialists should inform patients of any need for further care as well. Finally, second opinions are given based on professional judgment. They should not be saying anything dishonest to incentivize patients to switch providers. Next, let's talk about auxiliary personnel. When it comes to auxiliary personnel, which include dental hygienists, assistants, or other staff members, we should protect patient health by assigning only legally delegable tasks to qualified auxiliaries. However, it's important to keep in mind that these tasks, which may include cleanings provided by a hygienist or impressions taken by a dental assistant, must still be overseen by the dentist. Now, this next topic is fairly obvious, but a dental provider should not practice while using controlled substances. It's also extremely high yield for your exam to understand that practicing while impaired is a direct violation of non-maleficence, which means to do no harm. Practicing while abusing controlled substances may hinder the provider both physically and cognitively, inhibiting their ability to perform treatment and make proper clinical decisions. If you become aware of a colleague found abusing substances, treatment should be sought immediately, and we should report to the Dental Society for professional assistance. Impaired providers should also limit activity and consult physicians should they need help. Dental providers should inform any patient who has been exposed to blood or infected materials in the dental office. Post-exposure evaluations are required to either check if the patient is safe or so that they can receive treatment as soon as possible. If the exposure came from any dental provider, they should cooperate by providing information and submitting to testing. Now, whether the dental provider decides not to work with a patient anymore or is retiring, the dental provider should not discontinue treatment without giving the patient proper notice and an opportunity to obtain services elsewhere. This gives time for the patient to find a new dental provider to continue treatment. It's also important to keep in mind that a patient must be informed and should have access to emergency care for up to 30 days after dismissal. And finally, dental providers should avoid personal relationships with patients as this can impair your professional judgment. Furthermore, this prevents the exploitation of the confidence placed in you by the patient. All right, everyone, that's all the content that I have for you in this video, so let's practice what we've learned with some practice problems, starting with question 1. A dental hygienist arrives at work and notices that the supervising dentist has the smell of alcohol on his breath and is exhibiting signs of impairment. Despite this, the dentist proceeds to treat scheduled patients. Which ethical principle is being violated by the dentist? Option A, justice, B, non-maleficence, C, beneficence, D, autonomy, or E, veracity. Go ahead and pause the video and come back when you're ready. Now, if you answered choice B, you'd be correct. Now, if you've been watching these videos in sequence, you may not yet know what all of the ethical principles mean. However, remember earlier in this video that we talked about practicing while being impaired is a form of non-maleficence because it puts the patient in the way of potential harm. The board exam tends to generalize the 5 ethical principles, so knowing examples of each of the 5 principles will help you crush this test. All right, let's move on to question 2. At a new patient appointment, a patient refuses x-rays due to fear of radiation. Despite the refusal and having no radiographic images, the dentist continues with a full exam and initiates treatment, including restorative procedures without any radiographs. Which ethical principle is being violated in this situation? Option A, justice, B, non-maleficence, C, beneficence, D, autonomy, or E, veracity. Pause the video once again, think about it, and come back when you're ready. And the correct answer for this question is option B, non-maleficence. While there are elements of autonomy being violated here, non-maleficence is the more correct answer. The dentist has no radiographic images to accurately diagnose. Because of this, they may miss small areas of decay interproximally and not have enough information about the bone health of the patient, yet they're still performing restorative treatment. Ultimately, this has the potential to harm the patient. Alternatively, if the scenario was about not informing the patient of the low radiation associated with dental x-rays or withholding information gathered from the radiographs, autonomy would be a better answer because the patient would not be able to make accurate and informed decisions. As we come to an end, let's do a quick recap of what we went over in this video. Under the ethical principle of non-maleficence or do no harm, we want to keep knowledge and skills up to date and refer whenever necessary. We should understand the steps to follow when substance abuse is present in the office. We should inform patients of potential exposure to any harm, and we should maintain professional relationships only with our patients. All right, guys, that's it for today's topic. Thanks for watching. Keep practicing, and I'll see you in the next one.